everyone. Do you have oily skin or a dry skin? What about your acne? What to do with the acne? What do I do if I get wrinkles very early? What about the itchy, red and dry skin? What are those? Is there any kind of serious problem? Do I have to manage it now? And what about other things, having white patches, psoriasis and so many n number of skin disease? Well, I know these are your questions, but let me tell you one thing today. By the end of today's episode, you are going to get all the answers. So stay tuned, watch the episode to the end. So Victoria's Secret, we all are so fan of that. We love the show, we love their laundries, we love the clothes, and let's not forget about the beautiful models who are so beautiful looking. I just love them, and I know so are you in love with them. So let's talk about Winnie Harlow. She is beautiful, she's glamorous, she's so super chic, but do you know she also has a condition which is vitiligo. I really admire her, the way she carries herself. I mean, look at the confidence, and she is a live example that you can live the way you want if you really want to do that. अगर आप में वो जज्बा है कि मुझे ये करना है, the world is your limit. You can achieve anything. There are a lot of people who would try to pull you down because of anything. The skin situation is one situation, but there is anything. किसी की नाक मोटी है, किसी की आँख छोटी है, किसी के बाल गड़बड़ हैं. I mean, people have ample number of reasons, but you have to have your own confidence. And speaking about vitiligo, like I said, we have a beautiful girl today. Her name is Anmol. So let's see what she has to say. Hi Anmol, how are you?
I'm good, thank you.
It is so good to have you here, and look at you, you're so slim, trim and perfect with a beautiful smile. I really love your beautiful gesture and so super chic. So I was speaking to I just mentioned my audiences that how Winnie Harlow is an iconic person. She's super chic, she's a Victoria's Secret model, and I'm sure you know about her as well. So what's your opinion on her firstly?
She's a legend.
Yeah.
Let me tell you that first. Okay, so when I first saw her, I was a small kid and I was struggling in my own skin. When I saw her, I was like, wow, she's so confident. Even with vitiligo on her skin, she is doing whatever she wants to do, and she is breaking those stereotypes, those societal beauty standards, and that inspired me to do the same. So I have to say that she is my inspiration.
I know, she is so brilliant. So speaking about vitiligo, it's an autoimmune condition, and a condition जैसे आपको सर्दी जुकाम हो जाता है, and आपकी बॉडी खुद उससे लड़ने के लिए काबिल बनती है. सिमिलरली इस कंडीशन में बॉडी को लगता है कि मेलानिन जो कि स्किन के कलर डेवलप करता है वो उसकी एनिमी है. दिस इज द सिचुएशन हाउ कैन आई कैन एक्सप्लेन vitiligo in a better situation, in a better condition. What do you have to say, Anmol, about it?
We can say that in layman terms, but what exactly it is, of course you said right, it is an autoimmune skin condition, but the exact cause of it is still unknown to the scientists, hence is the cure.
Yeah.
We have a lot of hit and trial methods for that, but we don't have one specific or one like this is the full and final treatment. We don't have that. Why? Because the cause is unknown.
Yeah.
Hence, we cannot say that our immune system thinks that the melanin is the enemy. I don't know if we can say that. But as far as I have read or I have researched about it, it's like melanin are very weak, and they just have this function of giving color to the cells. So they are very weak. So when immune system attacks its own self, melanin dies.
Yes.
And hence the skin loses its color.
Yeah. Very well explained, I'm sure, because you must have done a lot of research. So when was the first time you got to know that you are facing this condition?
I was 6 when I first got my white spot, that is on my eyelid, and my elder sister first noticed that, and when we visited the doctor, he said that I have vitiligo. I was diagnosed with vitiligo, and there was a sense of panic at my home. So ever since then, till 4 or 5 years before, I was continuously under treatments. Nothing seemed to work, of course, but yeah, I was continuously under treatments.
So it has been 4 or 5 years till
then
now.
I have stopped the treatment.
Okay, and what age were you when it was discovered?
I was 6.
Okay, So I know it's a very tough situation, particularly with some kind of mindsets. Again, I won't say anything because we all are learning, developing, and I'm sure the acceptance has gone much more better with everything. So I really want to ask you, which is a little sensitive, but I'm sure the question would inspire a lot of people or the listeners out there. So when you discovered it for the first time, how did you face, how your friends and your peer group, how did they react to it?
Okay, like I told that I was first diagnosed with vitiligo when I was 6 years old. So I think I was at a very tender age to understand what it is and how my friends are reacting. I was not in my senses, to be honest. So at that time, I believe it were my parents who suffered more. Listening to people's taunts or like suggestions while walking on road, somebody randomly just says कि अरे इसको ये है, आप यहाँ लेके जाओ, इस डॉक्टर के पास जाओ, इस वैद्य के पास जाओ, या पता नहीं ऐसे इस पंडित के पास जाओ, पता नहीं क्या क्या. तो मेरे को तो समझ ही नहीं आता था. तो मेरे को तो क्या ही, मतलब मुझे लगता था कि कुछ अलग तो हो रहा है, बट वो क्या है वो कभी समझ ही नहीं आया. तो हाँ, उस टाइम पे मेरे पेरेंट्स बहुत ज़्यादा सफ़र कर रहे थे. उन्हें भी पता नहीं था. कुछ डॉक्टर्स कहते हैं कि दिस इज़ अ लॉन्ग टर्म ट्रीटमेंट, आपको टाइम देना पड़ता है एक ट्रीटमेंट में. बट मेरा एक स्पॉट से स्टार्ट हुआ एंड वी विजिटेड डॉक्टर्स, वी स्टार्टेड ट्रीटमेंट. तो वो बढ़ रहा है, उससे बढ़ रहा है. दे वर ऑल्सो पैनिकिंग, वो डॉक्टर शिफ्ट कर रहे हैं. तो ऐसे करते 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 नाउ इट इज़ ऑन 95% ऑफ माई स्किन. तो कभी कभी मुझे लगता है कि अगर थोड़ा उन्होंने पेशेंस रखा होता, एक डॉक्टर के पास रखा होता, तो शायद सीन कुछ और होता आज. बट इट्स ओके. We all are learning, and maybe I was destined to be here, so that's why.
I really like your spirit because of course we all have our journey, and sometimes हमें लगता है कि शायद ये अच्छा होता या फिर ये हमें करना चाहिए था, ये अच्छा होता. But then I think we are there to do something more better. Maybe give something brilliant to the society. So how do you keep yourself motivated? Definitely, since it's a challenging situation with the worldly things out there, how do you keep your mental health sane? सबसे पहले तो मैं ये पूछूंगी because सबसे ज़्यादा effect.
Of course. So vitiligo is just the depigmentation of skin. It is not harming me by any which way physically. No irritation, no itching, nothing like that. But how it is harming me or other people with vitiligo is that mentally and emotionally. And why is that so also? Because of lack of awareness in society. Because people don't know what it is and how it is to be dealt with or how it is treated. So they are coming up with all the bullshit they can. So because of that, because of people's reaction or because of people alienate us or like borderliners, they don't talk to us. Actually, they didn't used to. Now so it's very normal. But I think that thing, that discrimination caused that mental health problems. So I was 6, like I told you. So I faced discrimination when I didn't even know how to spell it. But again, I would say that I was very young to understand that what is happening and why is it happening. By the time I realized it, that okay, this is happening and what it is and how I can deal with it, I just realized that I am and I can be much more than my looks. My looks are not in my control. So what is in my control, I should be focusing on that, and which at that time was my academics. So I tried to focus there. I was different, that I knew. But how to be extraordinary? वो different को extraordinary में कैसे convert कर सकते हैं? वो मैंने छोटे-छोटे goals रखे अपने लिए कि ठीक है marks ज़्यादा लाने हैं सबसे and फिर अच्छे college में admission लेना है and ये वो. तो ऐसे करके छोटे-छोटे goals मैंने लिए and that the one thing that remained constant was that I am and I can be much more than my looks. So yeah.
Lovely. So speaking about your education and what you're doing currently, would you tell us, throw some light that what are you currently doing and what's your future goal and where do you want to see Anmol in next 5 years?
Yeah, sure. So I started with open mics and ऐसे मैंने किया. इसकी वजह से मैंने अपना PhD का plan थोड़ा delay करा कि ठीक है अभी तो पूरी life पड़ी है. Let's just give some time to this thing. And I was just doing that. फिर मैंने Instagram पे डालना शुरू करा. तो पहले तो मैं नॉर्मल पोइट्री ही करती थी. देन आई रियलाइज कि मैं कर सकती हूँ, मेरे पास स्टेज है, मेरे पास ऑडियंस है, तो व्हाई नॉट रेज अवेयरनेस अबाउट इट. देन आई स्टार्टेड राइटिंग ऑन विटिलाइगो. मतलब वो मैं पहले भी लिखती थी. आई स्टार्टेड परफॉर्मिंग. पहले मैं इसलिए नहीं करती थी, मुझे लगा सिंपैथी गेनिंग ना लगे क्योंकि मैं इसको नॉर्मलाइज ही करना चाह रही हूँ. बट फिर मुझे लगा नहीं, पीपल स्टिल डोंट नो अबाउट इट एंड एज अ पर्सन who is educated and who has vitiligo, I think it's my duty and responsibility to make awareness, to raise awareness. So then I started doing that. I started posting on Instagram also. So there I got an opportunity to act in a web series. I was just pursuing my poetry thing.
Oh, that's a fabulous journey. I mean, your story absolutely say that how you got confidence by your own achievements, by the things which by the talent you had, and how you achieved what you wanted, and once you have the confidence, the universe is the limit. I think that's absolutely right for you, breaking the norms, the fixed thoughts. You have just achieved what you want. I'm so congratulations for you coming for the web series. And
it's a very small role there, but okay, we need to start somewhere. We need to bring this into mainstream, that okay, this thing exists and we cannot ignore this. We have to acknowledge elephant in the room. And like I always say, that our skin color depends on the melanin we have.
Absolutely.
So if we have more melanin, we are
dark.
And we're subtly dark complexion. And if we have like less melanin, then we have fair complexion. And if we have uneven melanin, then we are artistically vitiligo glowing. So the scientific name of this is vitiligo. Like I told you, I used to write poetry. So पहले मैं ऐसे लिखती थी कि just like its last 3 letters, it says to me, I go, vitiligo चला जाए यहाँ से. But वो जाता तो नहीं था, of course. But then I made it कि चलो ठीक है तो है. How I can deal with this. So I made it vitiligo glow.
Oh, I love the name.
Yeah.
Why don't you say some, a small poetry if you want to, share today with us,
about
just
vitiligo?
anything, whatever you have written, maybe just because, since your story is so pretty, it'll be lovely to hear something from you.
हर गुजरते लम्हे के साथ ये विटिलाइगो भर रहा था एक नई ही उड़ान, तोड़कर मेरे सभी ख्वाब, हसरतें और अरमान. पर जब तक मैं खुद को कमजोर समझती रही, सिर्फ खुद की कमजोरी से मिलती रही. पर जब देखा खुद को इस सफेद अंधकार को हटाकर, सिर्फ खूबसूरती ही खूबसूरती दिखती रही. और उस दिन से कभी हार नहीं मानी, क्योंकि लिखनी थी खुद अपनी ही कहानी. किताबों को दोस्त बनाया और सबसे ज्यादा सुकून खुद के साथ पाया. आज करीबन 18 सालों का है मेरा और मेरे विटिलाइगो का ये रिश्ता, और आज मुझे खुद से खूबसूरत इंसान कोई नहीं दिखता.
So speaking about skin health and skin diseases, everyone wants to have a lovely, amazing, glowing skin. But there is definitely a lot of effort which goes behind it, and also a certain kind of maintenance routine which one needs to follow. So today with us, we have Dr. Sarisha Singh with an experience of 23 years in dermatology. So very welcome, Dr. Sarisha. How are you?
I'm great, thank you.
Great. So, we are having a conversation on, various kind of skin disease and then what are the most popular skin diseases in Indian skin. And also, since we got this question from our audience, that what are the most popular skin diseases which one needs to be aware of during the summertime?
So in terms of the common skin diseases that we see in summers, the commonest problem we see in dermatology outpatients department is skin infections. We see a lot of fungal infections. We're a tropical country, it's hot, it's humid, it's an ideal weather for fungi to grow and thrive. We see a lot of fungal infections in the elderly, people who have immunocompromised states like diabetes. But we see a lot of fungal infections in perfectly young, adult, healthy males and females, and even in children.
Yeah, because there's so many vast number of infections which one can catch during the summertime, and also a lot of teenager kids, whose acne are just spreading all over, and just because of dandruff, which also does dandruff also increases during this season, because a lot of kids and teenagers, they face dandruff issues and acne issues, and then they have acne on the back, all around the face. So what is the reason? Does it also related to the summer, or it can happen in any weather?
So there's scientifically speaking, there's no seasonal variation to acne. Coming to dandruff and acne, dandruff does not cause acne. The two tend to coexist, because it's the same internal problem which leads to both dandruff and acne. Is basically kids when they turn 13, 14, 15 and they hit adolescence. Due to the hormonal changes, the hormones increase the size of their oil-producing glands, which cause both dandruff and acne. We do see a lot of acne during the summer months, but I think it's more because that's also the time when teenagers and young adults are off from school.
Yeah.
and they tend to focus a lot more on themselves, and it's a good time to start treating acne, and it's a good time to start getting into a healthy lifestyle and a healthy skin routine because they have the time and the mental mind space to do it during the summer break.
Yeah, but how can one maintain? Let's say if young adult is having excessive acne, how can one take care of it so that it doesn't flare up a lot?
So the best thing one can do in the adolescent years is to have a regular skincare routine. If the acne is not too bad, they can get products over the counter and use it. But if the acne is troublesome and if they find that over-the-counter products are not adequate to control their acne, or especially if they find that they start having scarring due to acne, the recommendation is to go on medical treatment. Ideally, they should see a dermatologist who would give some medicated creams and ointments to help reduce the burden of acne. If creams and ointments doesn't work, you can always scale up to tablets as well. But it can be easily controlled.
Creams and start with some topical cream and proceed
Start
from
with
there.
some topical creams and ointments and scale up to tablets if required. And we also generally advise an active lifestyle because we do see that a lot of teenagers and young adults, they have this hormonal imbalance called polycystic ovaries. So the consultation will always also include a discussion on lifestyle factors like the diet that they eat and including regular exercise in their lifestyle.
Doctor, you also spoke about how fungi infections and things like that are in adults who have diabetes and other kinds of sensitive health issues they tend to face during this time, right? So is it and you spoke that how humidity flares it up more, but what about the places like like Delhi, it's dry? What kind of chances are there, like what kind of disease one catches in extreme dry weather, let's say Rajasthan, Delhi, where the humidity level is very, very low?
So in addition to skin infections, we commonly see a lot of allergic rashes. We see a lot of allergies to sun exposure this time of the year. Because the skin tends to go dry, people who have sensitive skin, they tend to have flare-ups of their eczemas as well.
Yeah.
So in addition to infections, yes, allergic rashes are also incredibly common during the summer months.
So basically avoiding sun and applying a lot of sunscreen, does that help in a regular way, in a regular routine?
So using a sunscreen, it is one of my most favorite topics. Using a sunscreen regularly is absolutely important for everyone. It helps fight a lot of aging of the skin. It helps reduce the chances of pigmentation later on in life. It slows down aging of the skin, the appearance of fine lines and wrinkles later on in life. And especially people who have photosensitive skin, that is skin which flares up when they go out in the sun. For them, a sunscreen is absolutely mandatory from a medical perspective as well, because the more they use a sunscreen, the less likely they are to develop allergies and rashes.
Wow, so many benefits of sunscreen. I wish I knew it prior, because I started using the sunscreen when actually of course when my skin was completely on the toss, and probably in my early 30s, which was actually a lot late. That was the first time, and I did not like the way sunscreen used to feel on my skin. So sometimes it was very sticky, sometimes it used to leave a cast, and I did not know there are so many beautiful sunscreen out there which does not leave any white cast. And speaking about sunscreen, there's so many options in the market. The mineral sunscreen, the chemical sunscreen. So which one should pick? And also about the SPF, because that's again so confusing. SPF 20, SPF 50, although the bigger number looks very lucrative. So should one opt for a higher number of SPF, or how does one choose a right sunscreen?
Okay, so coming to the first half of your statement, you're right. Most of us grew up at a time when we didn't know that we use a sunscreen. And studies have shown that what damages the skin is cumulative exposure. That is exposure that has added up on a daily basis from birth to whatever age we are today. And the maximum exposure that we have had cumulatively has happened before we have turned 20. So in an ideal case scenario, today the children should start using sunscreen from a younger age to prevent damage further on in life. In terms of choosing a sunscreen, there is no one sunscreen which will work for everyone. In terms of SPF, as long as it is SPF 30 or more, it is reasonably good because SPF 30 will give about a 90-93% protection.
Okay.
If we go up from SPF 30 to say an SPF 17, the protection will go up from say 93% to 96-97%. So you don't get that much of an increment in terms of protection. But an SPF 70 is more likely to leave a white cast and feel very sticky, and so one is usually less likely to use it.
Okay.
What is important with the sunscreen is you put it on 15 minutes before you go out in the sun, because especially chemical sunscreens will take that 15 minutes to take effect. And each time we put on a sunscreen, it works only for 2 hours because we sweat, we wipe our faces, and we all have this tendency
we rub our hand all on our face all the time.
Absolutely.
Yeah.
Absolutely. So what's important is we need to reapply it every 2 hours to keep getting the benefit of the sunscreen. And a lot of people think, you know what, it's very close. I'm out in an air-conditioned car. I don't need a sunscreen, but that's not true. It's ultraviolet light that we're protecting ourselves from, and that penetrates through glass. So if you're traveling in an air-conditioned car, an air-conditioned bus, or even if you're sitting in your office which is fully air-conditioned but there's a big French window near you which allows natural light to stream through into the room, sunscreen is absolutely mandatory.
Oh my God, that you have to wear your sunscreen. There is no other alternative for sunscreen.
In my opinion, in terms of a take-home message, if there's one thing one has to include in their skincare routine, it's a sunscreen.
Oh, and doctor, there's a lot of fun ways of putting sunscreen these days, which is all across Instagram, by using 2 fingers, some say that put it all, dab a little bit and then rub it off, and there are so many ample ways, and we see so many reels on the ways of applying sunscreen. So is there, in fact, I saw somewhere that, if you want to measure your sunscreen, use a spoon, add a spoonful of sunscreen and then apply it on your face. I found it a little funny, but is there any actual way to apply sunscreen, or you can just use it like your lotion and your cream?
So see, scientifically speaking, there's no clear recommendation you use 5 ml or 10 ml of sunscreen. I suspect the Instagram reel they're basically saying use 2.5 ml because a teaspoon is 2.5 ml.
Okay,
I guess it's relevant in terms of using adequate quantity of the sunscreen. But 2 fingers, 1 finger, your full hand, your palm, no difference. Use a sunscreen.
Great, that's very good info. Straight away I would like to discuss upon the IV therapies, which is like so common in the West, and it's getting popular in India as well. And we see so many benefits of IV therapies when the body is not accepting some kind of minerals, and the body is continuously rejecting, and or there are ample number of various IV therapies, whether it is for hydration, whether it is for any kind of energy boost. So do you think it does give any kind of good effect to body if anyone chooses any kind of IV therapies?
So scientifically, unfortunately, there haven't been very clear trials on the benefit of IV therapies. But anecdotally, a lot of people who've taken IV therapies feel a sense of wellness and feel a sense of an energy boost. And the fact that it is so popular in the West, and there are a lot of wellness centers mushrooming all over the world, means there are people who clearly feel well and they see the benefit of the IV therapies, and that's the reason it is booming. In terms of medical benefit, it would certainly benefit people who have some absorption issues, where they're not able to absorb enough adequate nutrients. People who have issues for whichever reason, they're not able to eat adequate quantities of food, or people are not able to eat high quality food, and they therefore have reduced vitamin levels and all. Medically, it would certainly benefit them. But in terms of wellness, yes, a lot of people take intravenous cocktails which has a mix of B-complex, vitamin C. I personally do use a fair bit of glutathione in my cocktails. Glutathione, it has been popularized in India as a skin whitening treatment. It's basically a master antioxidant. It helps to swallow up the free oxygen radicals in the body. So it helps to reduce the tan, it helps to reduce pigmentation, it gives a nice healthy glow to the skin. It also quenches the free oxygen radicals in your body, so it could help to minimize damage to the liver, kidney and the internal organs as well.
So I mean, glutathione is the master antioxidant that what has been said, and it works wonderful for the, I think, liver detox as well.
Absolutely.
And adding up with vitamin C, again, that's a wonderful antioxidant. So you're adding up double benefits. I don't think there can be any harm in this, but what are the certain precautions which one need to take, if somebody is opting for, IV wellness?
So certainly there are some contraindications in which case the IV therapy should not be done, like it should not be done in pregnancy, it should not be done in a breastfeeding woman. It's certainly not recommended if somebody has a kidney disease or has cardiac issues. The risk that can happen is, when we eat food, basically the body, biologically it is kitted up that the food gets digested, the nutrients get absorbed slowly. So in the bloodstream, the vitamin levels, they increase at a slow rate. When we do IV, we're basically bypassing the whole digestive absorptive system. So there's a very sudden drastic increase in the vitamin levels
in the blood.
Yes, but vitamin C and glutathione are both water soluble. So really there's not that much of a problem with water soluble nutrients, because as long as our kidney functions are okay, they get excreted. I would certainly think twice about giving vitamins which are fat soluble, like the vitamin A and D. With those vitamins, we definitely have to do blood tests and see if a person is deficient, and only then give the injections. Without the blood test, those injections would not be recommended.
Of course. And what are your thoughts about the lovely cocktail names called, the Myers cocktail, which is a really it cocktail for, a lot of people in West, and a lot of health coach, they speak about it in a very huge way. And actually, what does go inside? Let's speak about what are the ingredients of a Myers cocktail.
So the original Myers cocktail, it came up in the US, and the original Myers cocktail was basically a lot of B-complex vitamins, vitamin C, and it had the nutrients calcium and magnesium as well. That was quite a few years ago, I think 1950s, 1960s.
The person called Meyer only.
By Dr. Meyer.
Dr. Meyer.
He was a medical doctor. And in fact, this was the first medical publication on using IV nutrients for wellness. After that, the Myers cocktail has been modified because, we currently have a lot more nutrients available. So now a lot of people add things like glutathione, selenium, zinc, amino acids like methionine, arginine. So people give it fancy names like modified Myers cocktail. And a quick look at the internet will reveal that, a lot of clinics sell them with very fancy names, Vitaglow, Metaglow. And
I think because we like the name so much, maybe the name give us the effect more than the IV therapy.
It's a fantastic marketing strategy. It's an absolutely brilliant marketing strategy. And a lot of clinics use this for a hangover after a night of excesses. Although the jury is out on it, but I suspect it might be more the fluids in the IV therapy which work for curing the hangover, because a hangover, a lot of it is dehydration. I don't know how much of it is just the fluid overload that the body is being given, and how much of it is the nutrients that have been given along with the fluid overload.
Great. So, overall we understood that, definitely IV therapies work well for the people who have deficiencies, whose body does not accept the nutrients very well. And apart from that, if we talk about IV wellness, it's a very beautiful thing, but there haven't been a lot of research done, but yet people are doing it and gaining good benefits out of it, like the popular names like Rihanna and so many Hollywood stars, and so as in India also a lot of people are gaining benefits out of it. And we also spoke about Myers cocktail and what are the concoction about inside it, and of course if the IV wellness nutrients are water soluble, there is a tendency that you might not absorb it completely, and the excess is always excreted out, so which is a good point, because
Absolutely.
and for the fat soluble minerals like vitamin D and vitamin A and other vitamins like that, one needs to be very properly medically assisted, and then one can choose for whether they want to opt it or they don't want to opt it. So, well, Dr. Suresh, that was a lovely conversation on IV wellness, and you gave us so much of insights. Do you think that and there are so many other, like you spoke about selenium, zinc and various micronutrients. We have been also listening that NAD and CoQ10, all these kind of things are also being included when people are who work out a lot or who want energy a lot or who have a really busy day. What's your opinion on those?
So there are also antioxidants, and a lot of cocktail mixes will have a cocktail of antioxidants as well.
Okay.
They'll have NAD, they'll have coenzyme Q10, glutathione, beta-carotene, astaxanthin. So it's a cocktail of antioxidants. I suppose they work on the philosophy is that two is more than one.
Okay. So, whatever you absorb, whatever you want to excrete.
Whatever your body doesn't need, over the next few days, it just gets excreted out in the urine.
Yeah.
But we need to make sure that it's a person who's got good renal functions.
Yeah, that's very important, and also it's a personal choice. If one needs to opt for the IV wellness, it's out there and it is showing good results, and and also you need to have a good excretory system working on it. That was quite an info on IV wellness. Since we were discussing prior to this show about the various kind of disease which exist in India, and some are autoimmune situations, some are by fungi, bacteria, things like that. So one of the autoimmune condition, which is vitiligo, what's your opinion on that? Is it curable? Does it have any kind of cut thing where you can just stop it there? Does it have any maintenance thing?
So vitiligo is a very complex skin problem, and like you rightly said, it's an autoimmune condition. There's no single path to managing vitiligo. It depends a lot upon the age of the person, the areas which are affected, whether the vitiligo is stable or it is progressive in nature. If it is progressive in nature, the first step, of course, would be to put the person on appropriate medicines, and there are medicines that we can use, like levamisole and steroids, to stop further progress of vitiligo, and it does work to halt progress of the disease in the vast majority of people. Once we have managed to achieve a stable condition and the vitiligo has been stable for months or years, we could consider doing surgery, and we could consider doing some skin grafting or melanocyte grafting. It does work in quite a few people. Success rates are decent. If somebody is very bothered by it, it's something that one could consider getting done.
So, about the skin grafting, if vitiligo is, spread all over the body, what do you think? Or has to be in a small area too?
Yes, you're right. A split skin grafting or a melanocyte grafting will work with limited disease.
Uh-huh.
But if somebody has involvement of virtually the entire skin, then there's no place to extract a graft from. In some cases, then chemical depigmentation of the remaining 5% of the skin which looks pigmented could be done. So at least the person has a uniform complexion all over the body.
Would you make us understand more about the chemical depigmentation? What's that?
So suppose somebody has vitiligo, and it's not very common. Suppose somebody has vitiligo which has affected more than 90% of their body surface area. They're white all over, but they've got some patches of normal skin in between. Say they're white all over the face, but they've got a small patch of normal looking skin in the middle.
Right.
And it's basically, vitiligo is it's visually disfiguring, and that's the only problem that people have. Internally, they're completely fit and well.
Right.
So to reduce the visual disfigurement and to improve the appearance, the small patch of normal skin that can be depigmented by using certain chemicals on the skin.
Okay.
So then at least they have a uniform color all over the face, and it doesn't look too bad.
Okay. So that was quite an info. Well, thank you so much, Dr. Sarisha. It was a lovely session with you. So, before closing the show, what do you have the words, which the people can do at home, or any kind of tips which you want to share? One thing which everyone should be doing when we talk about skin health.
So, well, my favorite line is there is no magic treatment. There's no magic to maintaining your skin. What is important is whatever you do, you're consistent about it. You do it on a regular basis, you do it on an everyday basis. So use a sunscreen, absolutely. Have a good skincare routine. Watch what you eat. Sleep well. Do not smoke. Do not stress too much. Exercise a little bit on an everyday basis. Basically, lead a good, healthy life.
Yeah.
If you lead a good, healthy life and you've got good internal health, it will certainly reflect in your skin.
Cool. So apply sunscreen and lead a good healthy life. So I guess sunscreen is the tip which we can take back. Thank you so much. It was fabulous talking to you.
It was fantastic being here. Thank you.